Leishmaniasis is a disease caused by parasites that are transmitted by the bite of infected sandflies. According to the World Health Organization, it is a neglected tropical disease found in many parts of the world, including Asia, Africa, and South America, and it is most common in tropical and subtropical regions, where the climate is warm and moist. The risk factors for leishmaniasis include living or traveling in areas where the disease is common, being bitten by infected sandflies, having a weakened immune system, and being exposed to certain environmental factors such as deforestation or poor sanitation. The most common types of leishmaniasis are cutaneous. This is the most common type of leishmaniasis, and it affects the skin. It causes sores or ulcers on the skin, which can be red, raised, and ulcerated. The sores can be painful and may cause itching and discomfort. Visceral. This type of leishmaniasis affects the internal organs, particularly the liver, spleen, and bone marrow. It can cause symptoms like fever, weight loss, and anemia. Mucocutaneous. This type of leishmaniasis affects the mucous membranes, such as the mouth and nose. It can cause sores and ulcers in these areas, which can be painful and disfiguring. The symptoms of leishmaniasis can vary depending on the type of the disease and the part of the body that is affected. The most common symptoms of leishmaniasis include skin sores. These are the most common symptoms of leishmaniasis, and they can appear as a single sore or multiple sores. The sores may be red, raised, and ulcerated, and they can cause itching and discomfort. Fever, which can be accompanied by chills, sweats, and headaches. Fatigue. People with leishmaniasis may feel very tired and weak, and they may have difficulty performing everyday activities. Weight loss, due to a lack of appetite and increased inflammatory state of the organism battling the infection. Enlarged liver and spleen, which can cause discomfort and other symptoms like jaundice. Anemia, a condition in which the body does not have enough healthy red blood cells. Anemia can cause symptoms like fatigue, weakness, and shortness of breath. Some of the common diagnostic tests for leishmaniasis include physical examination. The doctor will examine the patient's skin, mucous membranes, and other affected areas to look for signs of leishmaniasis, such as sores, ulcers, swelling, or redness. Laboratory testing. The doctor may take a sample of the infected tissue or fluid from a sore and send it to a laboratory for testing. The laboratory can use a variety of techniques, such as microscopy, culture, or PCR, to identify the presence of the parasites that cause leishmaniasis. Imaging studies. The doctor may order imaging tests, such as X-rays, CT scans, or MRI scans, to get a detailed view of the internal organs and tissues. These tests can help the doctor to diagnose leishmaniasis and to determine the extent of the infection. The treatments against leishmaniasis include antimonial drugs. These are medications that contain antimony, a chemical element that can kill the parasites. These are the most commonly used treatment for leishmaniasis, and they are usually given as an injection into a vein or as a shot under the skin. Amphotericin B. This is a medication that can be given intravenously to treat severe cases of leishmaniasis. It is a powerful antifungal drug that can kill the parasites that cause the disease. Miltefosine. This is a medication that can be taken orally to treat some types of leishmaniasis. It is less commonly used than antimonial drugs, but it may be used in cases where the infection is resistant to other treatments. Phototherapy. This is a type of treatment that uses light to kill the parasites. It involves exposing the infected area to certain wavelengths of light, which can kill the parasites without harming the surrounding tissue. Surgery may be needed to remove infected tissue or to repair damage.